Okay, let's get the party started. Hello, everyone. So I'm here again. I want us to talk about third trimester. My name is Sophia, and I'm your number one midwife. All right. So I want us to talk about third trimester. When you hear the third trimester, what comes to your mind? A lot of things, right? You don't even know where to start from. You don't know how to explain it. We know. We the mothers, we know what is going on in third trimester. Some people might not really know what third trimester is. It's the last phase of pregnancy. Oh yeah, TTC mom, I need you people here. Pregnant moms, yeah. Expectant moms, oh yeah, push yourself. Let's discuss. Let's talk more. Let's have a conversation of your experience during your third trimester. How was it? Was it beautiful? Was it a very good period? Was it a time that you are like, oh God, I just want it to come and go fast, I'm tired. Yes, you get to that point. Third trimester is something I will never forget. Pregnancy, yes, is a good thing. Is a blessing from God. Babies are blessing from God. But you see the experience, as in, like, you take the experience one after the other. You know, when you are intentional about something, when you are so intentional about your pregnancy, you monitor it from the first, second, and the third trimester. You will now ask yourself, wow, so this is how it has been. This is how we've been going, isn't it? Okay, enough of the talks. Let's dive into our discussion today. Third trimester is the last phase of pregnancy journey. And that last phase of pregnancy journey, it starts from 28 weeks and it ends in 40 weeks. Sometimes it might be 41. It depends on when the baby decides to come. All right? But the ideal time is from 28 weeks to 40 weeks. During this period, let me tell you what will be happening to your system. So many tightness of your muscles. The tightness of your muscles will be happening to you at that point in time. You start having some pain from your lower region, to the top of your tummy. You start having this tightness. It goes from the side this way. You start having tightness of your muscles. Most times people tend to call it Braxton Hicks contraction. It doesn't last. Is a false label, right? It doesn't last that long. It will just come. It will just stay for some time and it will dissolve. And it's always within this, your round ligaments around here, where your muscles are. That is where it is. There's tightness of, like, there is a stretch in your abdominal muscles. You start having this most of the time. Sometimes it will just like 10 to 15 seconds, it will stop. Sometimes maybe it's not even up to 30 seconds. Sometimes maybe 30 seconds, it will come and it will go. All right. During this period, like, the movement will be consistent. Most people, they say they have pattern of baby movement in their womb, right? Fetal movement. But most times, most people don't have patterns. The baby might just keep moving at any point in time. Whenever the baby decides. Sometimes when you're sleeping, that's when the baby will decide to move. That's when the fetal, you start feeling fetal movement. Sometimes in early hours of the morning, sometimes even when you're sitting down. So most people don't have pattern. Some people, when you ask them at what time does your fetal, do you normally feel your baby's movement? They say, okay, it happens by 12 o'clock, it happens by this, blah, 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 blah. But sometimes it doesn't happen like that. So don't use your own pattern to, compare another person's pattern, because it might not be the same. All right. So now, during this period, what will happen to you is frequent urination. You'll be going to the toilet at every 5 minutes. Sometimes maybe 1-2 hours. You see yourself going to the toilet, and when you get there, nothing comes out. Just little urine. The urgency will be there. You want to go and urinate. And you feel it, because when you stand up, your bladder is already heavy. As in, you start feeling like a difficulty underneath your tummy. But whenever you get to the toilet, nothing is coming out. It happens. Sometimes when you get towards your 37, 38 weeks, or even 36 weeks, you start having frequent stooling. You start going to the toilet, you start passing out stools most frequently. You don't have to be scared. All right? Even at that point in time, you won't be able to sleep. At night, you manage to sleep sometimes, but you find out that you are always awake. Your eyes are always open during the night. You're always awake during the night. You sleep maybe 2 hours, 3 hours. You can't be able to sleep. So women will say, okay, during that period, when it's getting towards the time of delivery, around 37, 38, 39, they will start cleaning up the house. It's not for everybody. It doesn't happen to every woman. Please, that time, yes, it's good for you to clean up the house. You feel like doing a lot of things, but please try as much as possible to rest. Because the journey that you're going to face on the day of delivery, it's not a day's job. Yes, it's not a day's job. You have to get ready. Get your body ready. Don't carry that. Don't take an exhausting body to that time. Don't take a body that is so tired to that particular day, because you get exhausted. All right? So please, monitor your system at this point in time. And another thing I want to advise is try and reduce eating. Yes, it's not easy. At that point in time, you want to eat and eat and eat. This period is like you want to eat. You are so hungry. Try and reduce the way you eat so your baby will not come out so big. Yes, it happens. Your baby will not come out so big. And during this period, oh my God, like, how will I explain it? There are lots of things that will happen to you. Most times you to walk to be a problem, because all your ligaments, you see, all your joints, your pelvic joints are aching. Just imagine, okay, maybe I'm standing straight. I'm not pregnant. I'm standing straight. I don't have anything that is pulling me forward. Now, if I stand straight, I'm not going to stand straight. I'm going to bend. They always tell me that I'm a penguin because of the way I walk. You know, penguins are always walking like this. That's how pregnant women walk. Whenever you're pregnant, you walk this way. So in order for you to, balance your gait so you don't fall, isn't it? So now, in this kind of thing, what you do is, you notice that your shoulders are pulling. Like this tummy is pulling your shoulders forward. It's pulling your shoulders forward. Your backs, the muscles at your back are aching. So whenever you sit, no matter the position you're trying to sit, your shoulders will be aching. Back and close to your scapula will be aching. Even down to your waist will be aching. Your backs will be aching. So that is why at that point in time, try, if you get someone that can do you a massage, fine. If you get someone that can, help you to massage your legs, it's fine. It's up to you, all right? But that point in time, try and get a position that will be good for you. Try your sitting position. Most times I recommend, abdominal belt, pregnancy belt. See a physiotherapist. If you're in a country where things are functioning well, I'm not saying the countries things are not functioning well there. If you're a country where they believe in all these things, you get a pelvic belt that can really help you. All right, get a pelvic belt that can help you lift the baby, the fetus up a bit, so you can, you can be able to function a little more before your due date. And there are some exercises that you can do when you're getting to that due date. Please, we can also do those exercises. Maybe next time I come your way, we'll talk about more about the exercises and how we can put them into effect. It's not everybody that can do it, too. It's not really easy preparing pregnant women to do exercise, but we just have to do it so we can be able to prevent anything called perineal tear during delivery. Yes, so we don't end up having episiotomy and so many things happening during that period. In fact, it is well. Everybody is going to carry their baby. As you're going to give birth, you carry your baby in one piece. You go home. As you go to you take yourself to the hospital, and with your baby, you come back in one piece. Okay, Babies are blessings from God. Till I come your way next time, remain blessed. Have a wonderful day. I remain your number one midwife, always at your service. All right, take care. Bye.